Good morning and welcome to the UCLA Center for Health Policy Research. My name is AJ Scheitler and I'm the Director of Stakeholder Relations here at the Center. Thank you very much for joining us today for a very important and timely topic. On October 10th, the federal government proposed changes to the public charge rule, and the public comment period to respond to their proposed changes ends on December 10th. Our center director and health economist, Dr. Inez Ponce, has been leading a team of researchers who have been working quite literally around the clock to understand how these changes are going to impact the state of California. Dr. Ponce will introduce our full team today as we move through what we have is a lot of information for you, a lot of great information for you. As always, today's webinar is being taped and will be archived on our website. We have also made the slides available on the website for download on their own. The address for that should be up on your screen. Additionally, you can reach out to our interim communications director, Vinitya Lai, who can send you the slides as well. Her address is also up on the screen. After today's presentation, we will have time for Q&A, and we're going to extend that time today if there are questions and answers to keep this conversation going, because we have a lot of information and it is very important. So if you're in the room, please stick around for that, and if you are online, please make sure that you use the chat function to list your questions, and we will get to them at the end of the presentation. And now, Dr. Ponce.
Thank you, AJ. Good morning. Good morning, everyone here in the room here at the UCLA Center for Health Policy Research, and also to those of you joining us remotely via webinar. I'm very thrilled to introduce two partners in this project. Tia Shimada, who is the Director of Programs at the California Food Policy Advocates, or CFPA. CFPA is a nonprofit statewide organization that works to improve the health and well-being of low-income Californians by increasing access to nutritious food. It's been founded since 1992. At CFPA, TIA provides overarching leadership for its programmatic work. She also oversees the development and execution of CFPA's annual research agenda. Her areas of expertise include policy advocacy, to optimize the federal nutrition programs, particularly school and summer meals, and harnessing research to drive public policy. Tia has a strong interest in advancing equity and inclusion through systems change. She received her Master's of Public Health from UC Berkeley and joined CFPA in 2009. So thank you, Tia. She'll be up here at the podium in a little bit. Also joining us in the podium is Laura Lucia, who is the Director of Healthcare Programs at the UC Berkeley Labor Center. The UC Berkeley Labor Center conducts research on a variety of workers' issues, and including issues on health and immigration policy. Laurel is the Director of Healthcare Programs, where she worked since 2009, kind of similar to Tia, going to CFPA in 2009, must have been a pivotal year, analyzing healthcare policy. Recent papers have examined the health coverage and economic impacts of the Affordable Care Act repeal on California, California's Medicaid expansion, health insurance for California's immigrants, and the remaining uninsured in California. She also analyzes the economic impact of public policy change, and I know that she is on a team that is a joint effort between UCLA Center for Health Policy Research as well as UC Berkeley's Labor Center called the CalSim program. She has served as elected officer for 2 unions, and she received an MPP, a Master of Public Policy, I have the same one, MPP, from UC Berkeley in 2005. So with that, those are our speakers today. I'd also like to thank our funders for this project, the California Healthcare Foundation, as well as the California Endowment. And I don't have it here, but I'd also like to thank a collaboration of the UC Center for Immigration Research Institute that helped fund some essential questions in the California Health Interview Survey that helped us in the identification of the people that are effective in our work today. So thank you. It's a rather long lecture today because there are a lot of estimates that we will be presenting. So giving you a roadmap on what we'll be presenting today. So first I'll do a very brief context setting on immigrants and the state of California. And then Tia will come up and talk about public charge definition and what the proposed changes are. I will come back up and talk about the methods, our approaches in the set of analyses that we will be presenting to you today. And then Tia will come back up to talk about CalFresh. Laurel will then come up and talk about Medi-Cal, and then continue and talk about the work that was led at the Labor Center on the economic ripple effect. Tia will come back to talk about taking action, and then we'll end with Q&A. So hopefully there'll be plenty of time. We have an hour allocated for this webinar, but as AJ said, that we can spill over past the hour if Q&A takes us there. So you'll see a bunch of people coming back and forth, but I hope that that gives you the roadmap. So in this great state of California, we've heard that it's the 5th largest economy in the world. We have close to 40 million people, and more than a quarter are immigrants. They were not born here in the United States. More than a quarter of our population, of our adults, teen, and child, are here born in another country. Lawful permanent residents or legal permanent residents or green card holders, there's about 3.3 million in California, and that's we're the home of the most LPRs in the country. 4 in 10 obtaining LPR status in 2016 were from an Asian country, but Mexico is the top country of origin for new LPRs, about a quarter, or 1 in 4 in 2016. We're also home to what are called mixed status families, and that is where there is a citizen child with a non-citizen parents, and approximately a quarter of the 9.7 million California children are U.S. citizens with a non-citizen parent. So I'm going to call up Tia here.
Good morning, everybody. I just want to start by echoing the thank you to everyone in the room, everyone joining us online. I very much appreciate the opportunity to be here connecting with all of you. I'm going to spend the next few minutes sharing some information about public charge. What is it, how it might change, and what's at stake. So U.S. immigration officials use the term public charge to describe someone who is considered likely to become primarily dependent on the government to support their basic needs. And immigration officials apply a specific test to determine who is likely to become a public charge. Currently, there are only 2 benefit programs that are relevant to the public charge test. The first is the receipt of cash assistance. So that is things like TANF, what we call CalWorks here in California, state and local general assistance, and SSI. The second is government-funded institutionalization for long-term care. For example, long-term care in a nursing facility. Beyond the use of these benefits, other factors that are considered for the public charge test, which are sometimes referred to as the totality of circumstances, include age, health, family status, financial status, and education. And sponsorship, as documented through an affidavit of support, can also be considered in the public charge test. The public charge test occurs in 3 different situations. When a person applies to enter the U.S. with a visa, when someone who is lawfully present in the United States applies to become a lawful permanent resident. A common term for that is when a person applies to get a green card, or when a green card holder leaves the U.S. for 180 consecutive days and then re-enters the country. Not every non-citizen is subject to the public charge test. There are some exemptions. Key to those exemptions are green card holders or lawfully permanent residents who are applying for citizenship. Also exempted are refugees, asylees, survivors of trafficking and domestic abuse, among some other categories of non-citizens. So as AJ mentioned, on October the 10th, the federal administration published proposed changes to the rule around public charge. And I'm going to spend some time talking through what those proposed changes are. The proposed changes would expand the definition of public charge to include not just individuals who rely on public benefits as their primary source of support, but also to include individuals who participate in certain health, nutrition, and housing programs, even if that participation happens alongside employment and work. The proposed changes very clearly favor those with higher income. If the proposed changes were enacted as they're currently written, having an income at or above 250% of the federal poverty guidelines would be considered what's called a heavily weighted positive factor, meaning income is not only considered in the public charge test, but it's considered at a higher rate or a higher influence as other factors. And just to give that 250% of the federal poverty guidelines a bit of context, for a family of four, that's nearly $63,000 a year. And that is higher than the median income for the United States. So again, really setting that expectation to open the door to folks with higher income and closing the door on folks without. The proposed changes also include much harsher standards for personal circumstances. So being a child, being a senior, having limited education, limited English proficiency, having low income, a medical condition, and no private insurance, and poor credit rating are all things that would count against somebody undergoing the public charge test. And in short, what those changes do, they make it a lot easier for low and moderate income folks to fail the public charge test and much harder to pass it. So among the really harmful changes included in the proposed rule is the expansion of the benefit programs that would be considered beyond cash assistance and beyond institutionalization for long-term care. So very specifically, the programs being proposed for inclusion are Medi-Cal, known federally as Medicaid, Medicare Part D low-income subsidy, CalFresh nutrition assistance, which is known federally as SNAP, and housing assistance, such as Section 8. I think it's really important to point out that these programs are fundamental supports for work, for education, for health, and for upward economic mobility. And if the proposed changes are finalized as they're written, accessing these critical programs would be considered a heavily weighted negative factor for the purpose of public charge. So one thing I did want to make sure I note is the proposed changes are not retroactive, meaning if the final rule is enacted, just the way it is written now, benefits that are received before the rule goes into place would not apply against somebody for public charge. I think it's also really important to point out that benefits and programs that are not specifically mentioned in the proposed rule would not count against somebody for the purposes of public charge. So programs that aren't included, things like school meals, WIC, EITC, if they're not specifically mentioned in the proposed rule, they would not apply for the public charge test. So we are working really hard today to be as clear and concise as we can. The actual text of the proposed rule is actually incredibly complex and incredibly confusing. And to nobody's surprise, it is generating a tremendous amount of uncertainty and a tremendous amount of fear. The release of the proposed rule also aligned with an uptick of anti-immigrant rhetoric and actions from the federal administration in the lead up to yesterday's elections. All told, that's adding up to an environment of threat and fear and real harm to our immigrant communities. But I do want to point out that there are many organizations and individuals across the country that are fighting back and that are fighting for friends and families and neighbors who would be harmed by these proposed changes. And at the end of today's discussion, we're actually going to share some information and some actions that you can take to join us in that resistance. So I will say, suffice it to say, the proposed rules around public charge run counter to our core values as a nation of immigrants. And here in California, counter to our values as a state that was built upon and that really thrives upon the contributions of immigrants. We can think about the depth of the harm of the proposed changes in three different ways. The first is those individuals who would be legally affected by the proposed new rules, who would be driven to either disenroll or deterred from enrolling in public benefit programs. We can also think about the individuals and families who are harmed by the fear and confusion and threat that are being stoked by the proposed rule. And those folks may pull back from public programs even though they're wholly eligible and are not actually subject to public charge. I think more broadly, we understand that entire communities benefit when everyone has access to food and healthcare and other basic resources. And in turn, entire communities bear the brunt when access is withheld. So the proposed changes to public charge would make us a sicker, hungrier, and poorer country. Before I hand things back to Nina to walk us through a discussion about methods, I want to leave you with with these stories that were conveyed by the team from the National WIC Association. In the first, a Spanish-speaking mom with a child who's enrolled in WIC visited a WIC clinic asking for her WIC checks to be canceled. She had heard that WIC was a part of public charge, and she no longer wanted to receive those services. I'll remind you that WIC is not a part of the current public charge rule. It's not a part of the proposed public charge rule. And the proposed changes haven't been enacted yet. But I think this story and other stories like it, and there are many of them out there, are illustrating the level of confusion that's already circulating throughout communities and illustrates the real harm that's already being done, even though the rule has not been finalized and it hasn't been enacted. So with that, I will turn things back to Nina.
Thanks, Tia. I'm going to go over the methods of our analysis that we're presenting today. But before that, we need to have some key definitions. We've used the term disenrollment, and disenrollment basically means when an enrollee stops participating in a program. There's a term chilling effect that's also been used, where this is specific to disenrollment from public programs by qualified enrollees, so people who are wholly qualified, as Tia said, for public programs, but may be confused, may be misinformed, and may actually fear that there might be some repercussions. And so these are the people that disenroll, although they may not necessarily be legally bound to disenroll. And the LPR is legal permanent residents or lawful permanent residents or green card holders. So public benefits that are included in the proposed public charge rule are cash assistance benefits. And so currently, the current rule stands since 1999 rule language. And the current rule includes cash benefits, including SSI, CalWorks or TANF, and other cash assistance programs, as well as public assistance for long-term institutional care. The new rule that's proposed expands to non-cash benefits, including food, health, and housing benefits, specifically CalFresh and SNAP. SNAP is the federal term, and Medicaid or Medi-Cal, as well as Medicare Part D, the drug benefit for seniors, and seniors for the low-income subsidy program. There's also housing benefits that are included in the language of the proposed rule for Section 8 housing voucher and rental assistance programs. What we are focusing today will be on CalFresh and on Medi-Cal. So we start with data from the California Health Interview Survey, and we use the 2015-16 data in part because the 2017 data just rolled out last week, but mostly because the 15-16 data includes additional questions on citizenship and immigration and visa status that are not available in prior CHIS data rounds. I want to emphasize that the California Health Interview Survey is an individual level response analysis. There we interview adults as well as adults who have children and respond for their children and then give permission for teens. So we do have a snapshot of the population of California, but it is still very much an individual level versus a household level analysis. We look at the chilling effect population. This is the potential disenrollment of individuals who are eligible for the federally funded benefit. The focus of this analysis is the federally funded benefit. Now, while we have programs in California for food and health that are funded partially or funded by the state or wholly funded by the state, our emphasis here in the analysis is on the federally funded side. For Medi-Cal, then we used our estimates of this chilling effect population for the federally funded benefit and multiply it by 2018 dollar amounts per enrollee for full scope Medi-Cal. This is for the Medi-Cal benefit. And because there are different populations that are under the Medi-Cal populations that have different premium amounts, as well as different federal share amounts, we look at the CHIP amounts, which is an 88% federal share, the Medicaid children, which is about 50% federal share, the ACA expansion population, which is a much higher 94% federal share, and others, which is at the 50% share. For CalFresh, it was a bit more straightforward because CalFresh is wholly funded 100% by federal dollars. In CalFresh, what we did do further is that benefit levels change depending on the county, and so we took average CalFresh dollar benefits levels by county and came up and multiplied those with the populations, the chilling effect populations that we estimated from the CHIS data. As the last step, that these inputs were informed an economic multiplier model called IMPLAN, and Laurel will talk more about that. But then these inputs then were used to estimate what the ramifications are in California's economy in terms of lost jobs, lost state and tax revenue, and lost federal dollars. So the disenrollment assumptions, again, this is the assumption that a certain proportion of people will disenroll from Medi-Cal or from CalFresh, but we don't know if this is going to be at it's not 100%, it's not 0%, but somewhere bound in that we use the 15%, 25%, and 35% scenarios. Our rationale is that we reviewed multiple studies of similar situations of confusion by a segment of immigrants that actually should not be affected by a pending law. And so we looked at welfare reform back in 1996 and a series of studies that tagged this range of chilling effect from 15 to 35% for all non-citizen immigrants and mixed family children, and up to 60% for refugees. The population that we're focusing on today is this orange circle. So if you think about these effects have these concentric circles of who could be affected. So in the middle is that direct population that Tia mentioned. So these are people who are adjusting their status, lawfully present immigrants that want to adjust to get a green card or are being sponsored to come to the United States, but who are also using CalFresh or using or enrolled in Medi-Cal. That population is actually a smaller amount because there's so many restrictions already that you have to be a lawful permanent resident and then with some time in the U.S. on the use of CalFresh and Medi-Cal, that we concentrate on the California population for our analysis of the chilling effect, which is this much larger group. I do want to say, though, that that our identification of the chilling effect may also include some of this direct group, so those who are lawfully present pending a green card application. And what this chart shows is the flow chart for SNAP eligibility or CalFresh eligibility for non-citizen adults. We focus on federally funded CalFresh or SNAP benefits, the population that are funded by those benefits. And we look at lawful permanent residents who have been here fewer than 5 years, under the 5-year bar, and as well as lawful permanent residents over the 5 years. And then this group of refugee or asylee and Hmong, Laotian, Cuban, Haitian, American Indian, Alaska Natives who were born abroad are also included here. And again, this identification was made possible because of the many questions that we have in the California Health Interview Survey. Another large group is citizen child of a non-citizen parent. A parallel flow chart would be for Medi-Cal, again focusing on the federally state-funded full scope Medi-Cal here, where the largest groups are lawful permanent residents who have been here for more than 5 years and citizen children of non-citizen parents. And then we also have some groups that fall in the non-citizen categories. There's a lot of interest that this will affect not just the state, but also it would affect our communities and specific segments of California's diverse population. So we also will present estimates at the regional level as well as for the major racial and ethnic groups. CalFresh.
I'm back. So for anybody who isn't familiar with CalFresh or anybody who just needs a quick refresher, CalFresh, again, known federally as the Supplemental Nutrition Assistance Program, or SNAP, provides nutrition benefits to individuals and families who are struggling to make ends meet. CalFresh benefits can be used to purchase food at grocery stores, at farmers markets, and other food retailers. In providing resources for food, CalFresh can help free up household resources to better meet other basic needs, be that rent, transportation, or childcare, etc. Roughly 1 in 10 Californians are enrolled in CalFresh. The vast majority of those folks, 85%, have income that's below 100% of the federal poverty line. And CalFresh supports some of our most vulnerable populations. Among the households that participate in CalFresh, more than 74% include children, and nearly 9% include seniors or individuals with disabilities. CalFresh is also a support for work. Nearly half of all CalFresh households have at least one source of earned income. So I'm going to take us back now to the chilling effect that Nina was just describing. And in this analysis, we found that the CalFresh chilling effect population includes about 860,000 people, and nearly 650,000 of those are children. On your right-hand side of the slide, you can see the chilling effect for CalFresh broken out by race and ethnicity. Clearly, Latinos make up the large majority with well over 780,000 people, and Asians make up the second largest portion with nearly 60,000 people. In examining possible disenrollment scenarios, we found that disenrollment from CalFresh could range from nearly 130,000 people to just over 300,000. And that disenrollment would mean a loss of 209 to 488 million federal dollars, CalFresh benefits that would no longer be coming into the state. So we know that many folks in the room, out there online, even those who may not have been able to join us today, may be interested in local analyses so that you can better understand how the proposed changes are going to affect specific communities. Especially given the time, I'm not going to go through this slide in detail, but as we mentioned before, the slides are available online and these numbers are accessible to all of you. And I'll leave this slide by saying that we've described here disenrollment scenarios and related losses in terms of CalFresh federal benefits by 7 different regions across the state. CalFresh is an investment in health, in productivity, and in stability for children and families. And I wanted to close the CalFresh portion of this conversation by just pointing out why CalFresh matters so much to so many people across our state. The program lifts hundreds of thousands of Californians out of poverty. And as you might guess, what might be intuitive, nutrition assistance programs help fight hunger. They improve food security, and it's especially effective in households with children. If you look nationwide, SNAP decreases food insecurity by up to 30% for households with children. SNAP is also associated with a host of positive health outcomes, from healthier birth weights to a decreased risk of chronic disease in adults to increased adherence with medication for seniors. And I think it's important to think even beyond all of those effects, CalFresh even reaches into things like school and education. Certainly, I think we could all agree that it is clearly fundamental that children have adequate nutrition in order to learn and develop at their full potential. CalFresh enrollment actually also helps to identify students who are eligible for free and reduced price school meals. And in turn, that eligibility for free and reduced price school meals helps drive both federal and state funding education dollars. So there are both harms in terms of individuals, in terms of households, and then here in terms of broader communities. I am going to turn things over to Laurel now to kick off this conversation on Medi-Cal.
Good morning. Thank you for being here this morning. Oh, we're going to take it. Good morning. I'm going to talk for a few moments now on how the public charge rule is likely to affect the Medi-Cal program and people's enrollment in California. And then I'm going to talk about the economic impacts of the proposed rule in the state. So I just wanted to start by providing some basic context about the Medi-Cal program. Medi-Cal is the name that California gives to the Medicaid program, which offers free or low-cost health coverage for children and adults with low income. And the program is financed jointly by the state and local and federal governments. About 1 out of 3 Californians is enrolled in the Medi-Cal program, and 6 out of 10 of those enrolled are in families with children. Of non-elderly adults enrolled in Medi-Cal, a majority work. 2 out of 3 adults enrolled in the program are working. We estimate, using the California Health Interview Survey, that 2.1 million Californians who are enrolled in Medi-Cal are part of the chilling effect population that Ninez described. 2/3 of this population are children. The vast majority, or 88%, are Latino. And the second largest racial and ethnic group is Asians, making up 8% of the chilling effect population. Using the scenarios of disenrollment rates of 15%, 25%, and 35%, Medi-Cal enrollment could decline by between about 300,000 people to over 700,000 people in the Medi-Cal program under the proposed rule. This equates to about $500 million in federal support for Medi-Cal, up to $1.2 billion in lost federal support for Medi-Cal. Like with the CalFresh estimates, we've also provided estimates by region because we know there's a lot of interest in the local impacts in terms of both how Medi-Cal enrollment could decline and how many federal Medi-Cal dollars would be lost. Why does it matter that people will disenroll from Medi-Cal? There's a large body of research describing the importance of Medicaid and its benefits in terms of health and in terms of other social outcomes, economic outcomes, educational outcomes, a variety of outcomes. And that could be a whole seminar in itself, for sure. So these are just some examples of why Medi-Cal matters. Research shows that children with Medicaid are more likely to graduate from high school and college, and when they become adults, they earn more and pay more in taxes. so there are very long-term benefits to Medicaid enrollment. California adults who have Medi-Cal are more likely to receive routine checkups than uninsured adults. And children with Medi-Cal are twice as likely to receive routine preventive medical and dental care compared to uninsured children. There's national research that shows how many lives are saved each year by Medicaid coverage, and extrapolating those estimates to California, thousands of lives are saved each year here as a result of the Medi-Cal program. So now I'm going to turn to talking about the impact that this proposed rule could have on our state's economy and jobs. The reduction in federal benefits under the disenrollment scenarios we've described would have a ripple effect across a range of industries throughout the state's economy. We modeled this economic impact using IMPLAN, which is an input-output economic modeling software package. Our analysis specifically focuses on the reduction in federal support for Medi-Cal and SNAP under the proposed rule, because those are dollars that are coming from outside the state's economy. We assume that any reduction in state dollars for Medi-Cal that might occur as a result of this proposed rule would be spent in some other way within the state's economy, and so we therefore focus on the loss of federal benefits. So to give an overview of the economic ripple effect, using IMPLAN, we estimate that a reduction of up to $1.7 billion in federal benefits, which is the sum of the CalFresh and Medi-Cal estimates we just presented, a reduction of up to $1.7 million in federal benefits would yield an even greater loss in economic output, or $2.8 billion. In other words, for every federal dollar lost, more than $1.60 would be lost from the economy. That's because when fewer Medi-Cal dollars come into the state and there are fewer healthcare jobs, healthcare workers have less money to spend in their local communities. That reduced spending by healthcare workers has a ripple effect on other industries like grocery stores, retail stores, and other local businesses. And so when those so IMPLAN accounts for the fact that dollars spent often circulate through the economy multiple times before leaving the state, and that's why they call it a multiplier ripple effect. A similar explanation applies in terms of the reduced CalFresh benefits. In order to make ends meet without CalFresh benefits, low-income families not only have to cut back on food expenses, but on other basic necessities as well. So as a result, the reduction in federal CalFresh benefits will result in lost economic output and lost jobs in a variety of industries. In total, we estimate that there would be between 7,600 and 17,700 fewer jobs in the economy under these scenarios. And in addition, there would be lost state and local tax revenue, which I'll discuss more in a minute. So as I've described, the economic effects would ripple through a variety of industries in California. In terms of the reduced federal support for Medi-Cal, 58% of the reduction in employment would be in the healthcare industry. Food-related industries would be the next largest industry affected. And for this analysis, we've defined food-related industries broadly as including grocery stores, food manufacturing, food agriculture, and restaurants. And real estate businesses like landlords and property management companies would be the third largest sector affected. In terms of the reduced CalFresh benefits, 18% of the estimated job losses would be in food-related industries. This is within a similar range as national estimates done by the U.S. Department of Agriculture of the economic impacts of the Supplemental Nutrition Assistance Program. The next top industries affected by the reduced CalFresh benefits would be in healthcare and real estate. So the top 3 industries are the same across both the Medi-Cal effects and the CalFresh effects. In total, nearly half of the job loss would be in healthcare and 10% in food-related industries. So we've also provided estimates of the job losses by region. You can check these out in the slides. And we've also analyzed the lost economic output by region. In both of these cases, the estimates are for the 35% disenrollment scenario. Finally, the state and local government would also lose tax revenues when there are fewer dollars circulating through the economy. This would occur through a reduction in sales tax paid, a reduction in state income tax paid, and a reduction in other taxes as there are fewer dollars in the economy. Using IMPLAN, we estimate that between 60 and 150 million in reduced state and local tax revenues would occur in the state. Now I'm going to hand it over to Tia, who's going to talk about some of the actions we can all take. Okay, this is the last time you're going to see me, but it is also the most important time you're going to see me. Well, the last time before Q&A. I'm not gonna run out of the room. I want to be here. I'm not running away. I think it is both fair and accurate to say that the U.S. has a long history of racist and mean-spirited immigration policy. In fact, if you look at the first ever federal policy on public charge, it was established the very same year that the Chinese Exclusion Act was established. So what we're seeing now isn't new, but we do have a chance to say that it's not okay. So I'm sharing a bit of a timeline here. We have mentioned now twice that the proposed rule was posted for public comment on October 10th. And that means that we have until December 10th for the public comment period for people, members of the public, to respond to the proposed rule. The feds must read, count, and consider every comment before finalizing the rule. And there is no timeline, there's no set timeline or deadline for them to do that reading, counting, and considering, so it's hard to put a firm date on when the rule would be finalized. But we do know that once the rule is finalized, it'll be enacted 60 days later. Public comments do work to change the trajectory of federal policy. Comments can not only influence a final rule and what the regulations contain, but they can also set the stage for other strategies like litigation. I'm going to share 2 examples with you. In 2017, the National Park Service proposed a dramatic increase to the fees required for members of the public to access parks. And the public responded loudly with more than 100,000 comments on that proposed rule. And ultimately, the feds decided to mitigate the extent of that fee increase. So they're an example of how the volume of public comments can really change what ends up in federal regulation. In another example, earlier this year in Kentucky, a judge struck down that state's Medicaid work requirements. And that judge who made that ruling relied heavily on public comments that had been provided based around those work requirements. So again, those are public comments that, separate from the regulation or a waiver, actually help to fend off the administration's attempt to limit access to Medicaid. So I want to say this very clearly. I'm actually going to say it twice. Commenting on the proposed rule is not lobbying. So just once more for emphasis, commenting on the proposed rule is not considered lobbying. And what that means is that anybody, any person, any organization, any academic institution, any public agency can, and I will editorialize and say should, be commenting on the proposed rule. And there has been a national goal set of reaching at least 100,000 comments on this proposed rule. And we are hoping that everyone in this room, everyone watching online, everyone who watches this recording later is going to be one of those 100,000 comments. Because every comment is important and because we need every comment to count, I'm going to share some best practices to keep in mind as you are drafting your very own comments.
So the first is that comments have to be unique in order to be counted. If the administration sees 10,000 identical comments, those will be counted as one. They won't be counted as 10,000. And we already know the number actually matters. So a good rule of thumb is that in drafting your comments, and it's fine to work off a template, feel free to do that, it's actually great, but in drafting your comments, make sure that about a third of the words are your own. And we would advise you to start with your own words so that someone doesn't have to search through your comment in order to find that unique piece. So keep those comments unique. The other is please only submit comments in English. And I find this a particularly frustrating best practice to have to share, but we do want to make sure that all comments get counted. So making sure that those comments are not submitted in languages other than English. Please don't offer suggestions about how to fix the proposed rule. The goal here really is to stop what's being proposed. It's not to refine what's being proposed. And please don't mention programs that are not already included in the proposed rule. So again, the programs that are included, Medi-Cal, Medicare Part D, low-income subsidy, CalFresh, and housing assistance, in addition to cash assistance and long-term institutionalization. Please do oppose the expansion of public charge to any of those additional programs. Though you may have a soft spot for one of the particular programs, please don't focus on that program at the expense of others. We want to make sure that we are pushing back on the expansion across all of those programs. And I will say you don't need to have specific expertise or personal experience with any of the programs. But if you do have that, expertise, if you do have that personal experience, please do make sure you highlight it in your comments. There are many organizations in California and across the country who are mobilizing against the proposed rule. And many of those organizations are sharing templates for comments, FAQs, and other resources online. We've listed some here, but this is by no means a comprehensive list. Just wanted to make sure that when you access these slides after the discussion today, you can go directly to some of these links and find the great wealth of resources that are out there to help empower you to submit your comments. So I will leave you with a final ask before I turn things back to Inez. I will encourage you all to fight back against this really harmful proposal. We know that every voice counts. We know that every comment counts, and we hope you'll join in. Thank you.
Thank you, Tia, and thank you, Laurel. I'd like to thank the team that made the building of the evidence to policy action possible today. From the UCLA side, Riti Shimkata, AJ Scheitler, Yuyan Wang, Zhao Chen, Dahai Yu. From the Berkeley side, Laura Lucia, who just met, and a very talented graduate student, Josue Chavarin. Dahai is also a very talented graduate student, sorry. For the California Food Policy Advocates, Tia Shimada and Jared Call, who is here today. And a special thanks to the California Health Interview Survey team who was helping us with last-minute adjustments. I was trying not to pull any special favors, but thank you very much for honoring the process. So we're going to start the Q&A, but we put highlights here because we presented a lot of information. So we culled just some of the top-level information that can get you thinking about our approach and our findings. We start with the lives touched, but we ended with an economic impact, and these are just a restate of the numbers that Laurel presented. Also, the high disenrollment scenario numbers are also presented here. And again, we end with that our analysis is try to get precisely at one particular aspect of the impact of this proposed rule, and specifically on those who are currently enrolled in Medi-Cal and currently enrolled in CalFresh, who are rightfully qualified to use those benefits, but because of confusion, fear, misinformation, would possibly disenroll. This again is only one piece. There are ripple effects, there are repercussions in terms of households, that you may be in a household that has a a non-citizen adult or child that could be affected by this, as well as this other piece that that Tia mentioned on this totality of circumstances, where these totality of circumstances could penalize your petition family member that could be coming here, and sponsorship of family members. So this could really change the nature of immigration immigration in California and the United States since 1965. So I just want to end here. The lives touch nearly 2.2 million Californians enrolled in CalFresh and Medi-Cal. A lot of the CalFresh enrollees are also enrolled in Medi-Cal. In the high scenario, the high-end scenario of 35%, approximately 800,000 would disenroll from either program. And I think what is really astounding is that over 70% of those lives touched would be children, mostly Latinos and Asians, but 9 in 10 would be Latinos in this state. So we open it up for Q&A, and I'd like to invite Laurel and Tia to come up here.
Okay, so we do have quite a number of comments already coming in, online questions, and we have a very robust crowd here in the room, so I imagine we're going to have a lot, so we will go back and forth between online and in the room. But I'm going to start with one question that was asked and answered online, which was, do we know how many public comments there are so far? And our wonderful partner, Ignatius Bow, chimed in. There have been over 44,000 comments so far, so we are well on the way to the goal of 100,000. But hopefully today we will have provided you with more information and impetus to go and make some of those comments. Do we have any questions here in the room? Please raise your hand.
Yeah, I'm Bruce Rankin from the board of the California Association of Food Banks and Westside Food Bank here on the West Side. Hi, Tia. So my question is, it was mentioned that there are varying amounts of benefit from county to county in California. Is that mentioned because of the 3 counties in the Bay Area where able-bodied adults have already lost their opportunities?
So for the purposes of this methodology, and I'll look to Jared to chime in additionally if he would like, what we were looking at was actual benefits issued, and they do vary county by county for a number of different reasons. So the average household benefit in each county it does vary.
But not because of rules.
It was not specific to ABODs. Or sorry, yes, correct. Yeah.
Those benefit amounts vary due to household circumstances, not because of any county policy.
Right.
Yeah.
Okay.
Yeah. Thank you for that.
Can you say what ABODs are? For the
Oh, excuse me. I'm sorry. In my alphabet soup, ABODs, able-bodied adults without dependents, and there is a lot of threat actually not just happening amongst public charge, but a lot of threat happening amongst that ABOD population, the threat to strip those folks of access to nutrition benefits as well. If you want to talk about that in further detail, my colleague Jared Call would love to talk to you about that and what we can do to change it.
Hi, another question from online. Do you know if there's been any assessment about the drop-off from covered California specifically?
Federal tax credits under the Affordable Care Act are not included in the rule, but like with other programs, there could be a chilling effect because people may not understand that. I have not seen any estimates of how many people might disenroll as a result.
Hi. Hi, my name is Alejandra Quintero. I work at Immigrant Defenders Law Center, and we support and accompany children and a lot of immigrants in Los Angeles. I have 2 questions. One of them is one of the slides. It said that the people that could be affected were citizen children of non-citizen parents. Does that mean it would affect, for example, if the non-citizen parent would at some point apply for some type of legal relief? Because I don't see how that would affect the citizen child.
Can I take a stab at that? So when we talk about the impact on that citizen child of a non-citizen parent, we're not necessarily talking about the impact of the legality of public charge. We're talking about the fact that that household, as a unit, may draw back from public benefits that they're eligible for. So, for example, they may not enroll that child in CalFresh. They may not want that child to access school meals. All things that that household is eligible for, but they wouldn't be accessing because of the fear, the misinformation, the confusion. Does that help?
Thank you.
Okay.
Yes, thank you.
Is the decision maker also
Mhm.
the child in terms of accessing healthcare and food?
Right, thank you. And my second question is, I don't know what the acronym stands for, but I believe it's called PROCAL or PROCAL. And my question is for the undocumented community that do qualify, for example, for Medi-Cal. If at one point they were to apply for some type of legal relief, would that affect them?
So, in terms of what is said in the rules, that there's the group. So right now California covers all undocumented children, and if it also excludes DACA as well. My understanding is the public charge rules exclude DACA. So I'm not sure, like there's also they're exempt from the rule, but it.
So if I could take that question
maybe
from a broader point of view, I think individual cases are incredibly complex. The rule that's being proposed is incredibly complex, and I don't feel, as someone who isn't an immigration attorney, qualified to comment on anybody's particular case or on those particular circumstances. So I think what we would do is, for folks who are working directly with communities that either would legally be affected or think they might be affected, I think we really are looking to those experts in immigration law to weigh in. I would say, the things that we can say right now that we know for sure, the rule, again, the proposed rule is not retroactive, so receiving benefits now isn't going to count against somebody when the rule does get enacted. The rule isn't final yet, and there is potential for it to change. So I'm sorry that I can't give more specific advice, but I think it would, that's more appropriate to come from someone who is really steeped in that area of the law.
Question from online. When making comments, is it okay to mention other programs such as WIC in explaining antidotes when talking about the chilling effect?
So I am going to look to my other colleague in the room, Gabby Tilley. I'm going to answer and say that what we've been hearing is that, excuse me, I'm not in the frame of the shot. I tend to pace. Sorry about that. Is that please do not mention programs that are not included in the proposed rule. We do not want to advertise this. We don't want to promote those programs as being targets for additional threats. So no, please do not mention those programs, WIC, school meals, EITC, those things in the public comment. I think if you wanted to share stories about about folks that you know, or folks in your community, folks in your own family who benefit from public programs and who need those resources to support productivity, to support health, that is both welcomed and encouraged. Gabby, did I miss anything? Okay.
Hi, I am Valeria with CLA, which operates farmers markets in different parts of LA, and also the Market Match program, which impacts CalFresh users. So I hope this isn't too far outside of the scope, because I know you're focusing on projections, but do you have sort of any estimates on how it's impacted CalFresh users thus far, given that, some rumors were already circulating earlier this year, and then looking back towards the 2016 election, how that's impacted enrollment numbers for EBT users and EBT eligible folks?
I'm happy to take a stab.
Okay. Yeah, go ahead. You're on a roll.
Is that a polite way of saying I'm hogging? So I think qualitatively we can definitely say we have been hearing stories from across the state about folks who are drawing back from CalFresh, drawing back from WIC, many of those programs. For the purposes of this analysis, we're not able to model with that specificity. I think we can speak to those different disenrollment scenarios and what that might mean for individuals and for the economic impact. But in terms of getting down to those very specifics, no, I don't think we're able to do this within the scope of the methodology. Is that fair to say?
Yeah, no,
Okay.
those disenrollment scenarios were based on the literature, particularly back in 1996, and so they're not based empirically from what we've observed over this period.
And I think that speaks to the real importance of having both this quantitative evidence base and then making sure that we are also highlighting those very impactful personal stories and what this is really doing to folks on the ground already. We're seeing the effects. Even if we can't put necessarily numbers to all of those effects, we are seeing them, and that makes them no less valid.
But anecdotally, it's something that matches. I'm just seeing sort of overall the trends of people engaging in some of these programs is dropping. It hit a peak right before 2016, like 2015, summer of 2016, and then you see this drop.
I would say that tracks with everything that we've heard, everything that we've heard from partners and seen from partners on the ground in terms of the general anti-immigrant rhetoric that has been affecting folks. Yeah.
Okay, question from online. Do we know if pregnancy-related emergency Medi-Cal will be counted against these individuals?
Emergency and pregnancy-related Medi-Cal are excluded from the proposed rule, or they're not included.
Any more questions in the room?
But they're part of a chilling effect
But
population.
right, there could be people who would be fearful about using those services, not knowing whether or not they could count against them.
Hi, my name is Irma, and I'm a Master of Public Policy candidate at UCLA. And I just had a question about the public comments. I know you said that there have been instances where there was over 100,000 and changes were made. Is there a certain threshold where, like, how many comments there are?
So there has been a goal of reaching at least 100,000, I think, based on past experience, but there is no hard and fast rule that if you get 100,000 negative comments, you have to make changes. The administration is required to acknowledge, consider, and address all of the comments made. And if that doesn't happen in the process of review, that actually sets the stage for litigation. So again, those comments are really helpful, both in terms of ideally changing the regulations flat out, but also allowing other strategies such as litigation to move forward.
We want to ensure that it's also 100,000 as uniquely as possible comments.
Correct, yes.
Yeah.
So 100,000 that have at least 1/3 of their words that are unique.
Timely question from online. When will the report be out so that folks who want to write letters and make comments and reference what you have said here today will be available?
Thanks for the question. We think that our effort between now and December 10th is to get our analysis out and disseminate it to the public through different fact sheets, one-pagers. So we are actually not going to have a big report, but we'll have a series of fact sheets that will be made available for different audiences. We'll also have a blog. We hope to get this done by December 1st. Yes.
And in the meantime, people should feel free to cite this presentation today.
Yes. So I'm going to combine two questions from online. Can you talk about some of the confusion specifically that might be happening for the DACA recipients? And also, can you expand on what types of visas are affected by the public charge rule?
Another way, everybody's looking at me. I'm looking at Riti.
So, and I won't put her on the spot, but Gabby, is that something that you think you can address? Did you hear the question?
I'm not sure about DACA recipients.
Okay.
But I do know that visa is for entrance visa. We're getting student into an entrance visa, so if you're coming from outside of the country and trying to enter, that counts. And a new change would also be a change of status for your visa. So if you want to go from a student visa to a work visa, then you might also face the test.
Thank you. That's why I bring them in the room.
Any more questions in the room?
I do want to say that we did not include DACA in our chilling effect estimates because we focused on federal, even though DACA students in California are eligible for Medi-Cal under state funded. Mm-hmm. So just that's that distinction here.
I'll be right with you. One more question online. Is there any messaging being prepared in anticipation of some form of rule being implemented to address the chilling effect?
Can you say that question one more time?
Can you say it again?
Is there any messaging being prepared in anticipation of some form of the rule being implemented to address the chilling effect?
I'm not quite sure how to interpret that question. If it means that we would see changes in the final rule that might hopefully mitigate the chilling effect.
I think
I will say I think what we are moving toward is public comments that will stop the rule from moving forward. So whether it is slightly less harmful for some subset of the population, that's not the aim. The aim is let's not have this rule move forward. Let's not create these changes at all for these programs and for public charge.
And I would just add that the Protecting Immigrant Families campaign, which is a national campaign involving hundreds of organizations, has been following the rule every step of the way and providing messaging guidance and providing resources so that people can understand it. And so, whatever happens next, I'm assuming that will continue to be a resource.
And that actually is one of the resources that we shared with you on the slide. So we will continue to look to that campaign for leadership.
Okay, Bruce Rankin again. So first of all, I appreciate your giving us some real ammunition about the public charge issue, so that if we're talking to somebody who says, well, this really isn't going to take it away from anybody. But in fact, besides besides the Medi-Cal benefit and the CalFresh benefit, of those extra items that were added, if it goes through, are there any of those where you don't have to at least have a green card to meet the threshold? In other words,
for things like housing assistance and for Medicare Part D,
are people now eligible who right then will become ineligible?
Basically, what's the direct and chilling effect for those programs?
We did not do that analysis, unfortunately, so I couldn't give you.
But for the housing,
right now.
do people need to have a green card at least, or be citizens? I don't know.
So I wouldn't want to speak authoritatively on that, but we can certainly follow up because we didn't include. Because that's not my wheelhouse, because we didn't include them in the model. That isn't something we went into detail, but we can finally answer that question, and Bruce, we can get back to you about it.
Question from online. Are there any actions or proposals coming or expected from the state legislature or leaders or the department that administers these programs to try to reach the recipients to reassure them on this matter?
I think that is a great
Not
question.
that I know of, but I think that is a good suggestion.
I think that's a great question, and I think when we think about taking action, we certainly think about taking action through the strategy of public comment. We certainly think about trying to create changes federally, but California has always been a leader in welcoming immigrants to our state and supporting those immigrant families, our neighbors, our coworkers. And so I think that there are advocacy organizations like ours that will certainly be considering those kinds of strategies as we move forward and as we recognize that the harm to folks across our state is potentially very severe.
In the Center for Health Policy Research, our listserv includes many decision makers, both local and state, and so hopefully the dissemination of this, the slides from this webinar and more of the material that we'll have later on before December 1st, by December 1st, okay, by December 1st, will spur action. I think the economic effects at the county at level, which we did not do, but at the regional level, I think will help. Hopefully, will spur not just state officials, but local officials to act.
Hello. This is a question that raised in my mind coming out of your analysis is about that chilling effect, and I think $1 billion economic impact, or from 15 to 35% of immigrant enrollees. That's a pretty wide, based off of 1996
disenrollment scenarios.
Disenrollment scenarios. That's a pretty wide range, and what I think folks directly involved in providing services, advocates, the Department of Public Social Services and the California Department of Social DSS, in order to mitigate that economic impact to the most vulnerable among us, trying to reduce that chilling effect is going to be paramount. And I think your research really shows that perhaps that's an area of what education is necessary to reduce that, and what efforts need to be taken, especially given, as you mentioned, the heated rhetoric coming out of the midterm elections, is going to be important, both especially for the Los Angeles economy in particular, and certain parts of Los Angeles which are where we have a number of immigrant families, working families dependent on benefits to feed their children and to provide health care for their children. Thank you.
Thank you very much for your comment. Do we have any more questions from in the room?
Just build on that for 1 second. That's what you do when you get an advocate in the front of the room. They just do not stop talking. So I just wanted to build on what you're saying. I think we certainly highlighted the importance of taking action when it comes to policy and responding to the policy through public comment. But I think you're absolutely right that there is also this call to make sure that we are spreading accurate information. And we know that there are many organizations, many agencies on the ground who are working in communities where folks need this accurate information. I think in all of the midst of uncertainty, as much as we can do to put that accurate information forward about what is public charge, what is being proposed, what's currently enacted, I think you're spot on in terms of that education and outreach piece. So thank you for raising it.
Okay, we have, I think, time for one final question that comes from online. It reads, the proposed regulation specifically requests comments on why programs not affected by the proposed regulation should continue to remain unaffected. Do you still recommend that I not, for example, give reasons about why a program like WIC should remain unaffected?
Feeling the question was coming
That's
up.
an advocacy.
I'm glad it was.
I'm going to point to Gabby again.
The Department of Homeland Security has requested comments on whether.
Hang on. Okay. There we go.
The Department of Homeland Security has requested comments on whether they should include CHIP, so the Child Health Insurance Program. So if you know anything about that, add that, but nothing else but CHIP.
Wonderful. Well, thanks to everyone for your participation. We are signing off here for the new year. We wish everyone a happy and very healthy holiday, and we will be back with our webinar series starting in early 2019. Thank you very much.
Thank you very much.
Thank you.